You ready? Good afternoon, everybody. Rich Fitzgerald, County Executive here with Dr. Deborah Bogan, Director of the Allegheny County Health Department, to do our weekly update on COVID-19. Dr. Bogan and her team in late June, early July, instituted some policies that really have been seeing us have levels drop to under 5% now today, and actually been coming down for a number of weeks. So the strategy or the policies that the health department have implemented, along really with the cooperation of the community, have really seen us lower the numbers to where we, again, today had 3%. It's the lowest we've been probably since mid-June, maybe early June, so a couple months ago. So I think people very seriously are taking the advice that is happening not just locally, statewide, but nationally. But we know as we get into late August, early September, as schools and other fall activities are contemplated and actually begun, we're going to see some things that concern us. And we've seen in other states and other universities, for example, North Carolina, Notre Dame, West Virginia University, where they've seen outbreaks. And we've seen an announcement that University of Pittsburgh, Carnegie Mellon University, some of our other universities have decided to go virtual for a period of time. And certainly that will be helpful. But the bigger thing that we're seeing and we're hearing already is the off-campus activities. So in neighborhoods like Oakland and Squirrel Hill and Southside and other places, nobody should be walking around on the streets without a mask on. These are crowded areas. These are densely populated areas with many people in houses, in apartments, we're a dense community, dense neighborhoods. We need to be wearing those masks. So you young people, we're relying on you. We're relying on you if we're going to have normal activities. If school is going to go back in a way in which we want it to go back, where you go into the classroom, or you go into your lecture hall, you go into your labs, it can only happen if everybody is cooperating. All it takes is a few to not cooperate and not want to do it, that the spread goes very quickly. We have seen how quickly the spread of this disease goes from person to person. So it really is all of us that have got to cooperate and got to work. I know our universities have really put these plans in place, have done a great job in trying to implement them, but they only work if the people in the community are all with it. So we've got to make sure that we're all cooperating. So social distancing, outside, wear your mask, communicate and connect in other ways, but we can't be congregating without masks and in the way that we did before. So that's my little whatever warning, that we want to make sure that this fall goes very successfully, and we don't want to have to do some of the things that other places around the country have begun. So let me now turn it over to Dr. Bogan to give the update on the numbers and some of the things that are happening over the last week. Dr. Bogan?
Good afternoon, and thank you for joining us. Before I jump into the numbers today, I want to invite everyone to just take a moment, take a deep breath, and be still. A couple of weeks ago, I had a meeting with the members of the COVID-19 team here at the health department. These are the people responsible for analyzing the numbers, for coordinating, testing, case investigation, and contact tracing, for sharing information with community groups, for working with schools and universities, for inspecting and visiting restaurants, and for staying abreast of this rapidly developing situation. At the start of the meeting, I gave them all 5 minutes to themselves, and I encouraged them to breathe, to meditate, to close their eyes. For some, it might have been the only 5 minutes they've had to themselves that day, and the only 5 minutes they've had to themselves in months. So today, please remember to take time for yourself. I'm reminding all of you to take 5 minutes or 10 minutes or longer for yourself. Close your eyes, breathe deeply, and rest your mind. Whatever you need to do to relax and step away. Surviving this pandemic means more than caring for yourself physically, it means caring for yourself mentally. These are very stressful times, and we need you, we need everyone to practice self-care while we care for one another. we're stronger together. Our numbers this past week continue to show a slow and steady decline. This week, again, on average, our new daily cases were below 100, and today's count of 27 is the lowest we've seen since the end of June. Our incidence rate, one of the two metrics the state suggests schools look at, dropped to 42.7 new cases per 100,000 residents for August 7th to 13th. Still in the moderate risk category, but lower than last week. Our positivity rate, the other metric suggested by the state, was 4.3% for that same time period, a small decline from last week, which keeps us in the lower risk category. I want to see those numbers continue to drop. The lower the numbers indicates there is less virus circulating in our communities, which helps us all feel safer when we leave our homes. Half of the cases interviewed last week indicated they didn't know where they contracted the virus, and only about 15% of the new cases were connected to a long-term care facility. This tells me that there's still quite a bit of virus out in our community, and we must continue to be vigilant. So please stay home and limit your trips out of the house to essentials. Wear your mask, keep your distance from others. Don't shake hands, give hugs or high fives. Consider an elbow bump or a wave instead. Wash your hands frequently with soap and water or use hand sanitizer. These are all steps we can take to keep our community safe. You may have noticed this week that we stopped including a daily number of new past or present hospitalizations in our daily reports. We did this because this week we have been entering into NEDS a backlog of information on older hospitalizations that we receive from the hospitals. Many of these hospitalizations were from July, and we didn't feel that a daily number of new past or present hospitalizations that included many hospitalizations from last month would be beneficial. The hospitalizations were added to the total count of hospitalizations. So why did this happen? During the surge in cases we saw through much of July, we devoted as many people as we needed to case investigation and contact tracing to stay on top of that to really prevent the spread of the virus. This meant reassigning people and some of the staff who'd been working on our manual data entry for hospitalizations into those issues, contact tracing and case investigation. So for those of you who are interested in hospitalization data, please visit the state's COVID dashboard and look at the hospital preparedness tab. This shows county by county look at the number of patients hospitalized, those on ventilators, percentage of beds available, and trends in hospitalizations. One thing to note in the data on the state website, this includes all patients hospitalized in Allegheny County, regardless of their county of residence. When we have been reporting data, we only report hospitalizations on our county residents. I want to assure you we are not ignoring hospital data. It is extremely important for us to follow this closely because it's an indication of the impact of COVID-19 on our community, and it reminds us each and every day about the seriousness of this virus. Over the past 5 months of this pandemic, nearly 1,000 Allegheny County residents have been hospitalized, and about 10% of those have received breathing support from a ventilator. Currently, there are about 20 people with COVID-19 on ventilators in our county fighting for their lives. As further evidence of the seriousness of this illness, nearly 300 Allegheny County residents have died during this pandemic and about 7,500 statewide. This is a serious illness, and we all have to get serious about containing it. So thank you all, and remember, please stay safe and be kind.
The first question that we have is from Public Source. Those 65 years and older represented 21% of the infections last week, but 61.3% of the hospitalizations, and many of the recently reported deaths were associated with long-term care facilities. Is there something more that can be done to prevent healthcare workers in congregate settings from spreading the disease to vulnerable seniors?
We have made lots of changes and provided more and more support to our long-term care facilities. There is a new requirement for PPE to be available that came out as a state order recently that goes into effect, I believe, in about a week. I think, it is when you work in long-term care facilities and you care for those populations, it's intimate work, right? You're helping people take baths, you're helping them walk down the hall. It is impossible to stay physically distant to do that kind of work. So it does rely on people being very vigilant about hand washing, wearing their PPE properly, and it's important to all of us to educate the staff that work in those facilities to use that equipment properly to keep themselves and those patients safe. And that is what the teams are doing that are part of the long-term care teams that have been working with those facilities.
This next question is from WESA. While the daily COVID case counts are falling, so are the number of tests that those results are based on. Why are fewer people getting tested?
We have definitely seen a decline in demand. Repeatedly, when our case counts go down, our demand for testing goes down. And that makes sense, right? There are fewer people worried about being exposed to the virus from a case. And that's exactly what I like to see, is that we are responsive to, as our cases increase, our testing increases. As our cases decline, our testing declines. And so I think that's exactly what we should be seeing. There continues to be a bit of a shortage for some of the hospitals are still reporting a lack of supplies, but I don't think that has dramatically impacted the ability to get tests at this point in our community for those who need it.
This next question is from the Post-Gazette. What do you think of the state's COVID-19 tracker app? Will you and the county be promoting its use and asking the state for data from the app?
I have had a little bit of an orientation to the app from the state. I am certainly going to encourage the use of the app. The app that the state selected is very conscientious and careful about privacy issues. And so yes, I think we should use all the tools in the toolbox that we have. And the app is just one more tool. It doesn't stand on its own. It is part of like a whole group of things that we're doing: case investigation, contact tracing, and the app just adds to that. And so I'm excited to have that available as soon as it is, and we'll continue to work with the state as they roll out the app. We will, of course, roll it out here. I think also it's particularly helpful in places like college campuses. So we are going to definitely encourage the use as much as possible.
We have several related questions from a few outlets, including WTAE and WESA, related to colleges and universities, partially which the county executive referenced. Colleges and universities in other parts of the country are reporting COVID clusters. How do college administrators convince students to practice social distancing and mask wearing when they're not in class? And related to that, is there, University of North Carolina had to shut down as a result of these cases. Are other local colleges better prepared than what we're seeing elsewhere in the country?
We are very fortunate. The college in Pittsburgh, our college campuses and the students they bring here really add a level of richness to our community that is really one of the great qualities of this community. So we're happy that students are here, but we want them to be really safe. So much like our county executive said, I'm talking to the students now, right? Our students really, when we welcome you here, we are thrilled you're here, but I as the county health director, I'm asking you personally to please be a really responsible member of our community and do the right things. Keep your parties small and intimate with your pods. Don't have big parties. Wear your mask when you're out walking around in Oakland. I was in Oakland just the other day and was sad to see that many of those walking around were not wearing masks. So I'm asking you, please put on your mask when you're outside and be a good member of our community. We're thrilled you're here. Our universities have given very careful consideration of their plans. We have reviewed them. We have met with them many times. Again, we have very strong leadership who are trying to do their very best to keep us all safe and their students safe and their staff safe. They have all put in, as part of their codes of conduct, adherence to our state and local guidance. And so that is one thing that they're doing. They are strongly encouraging and mask wearing, hand washing, limiting access. They're all doing screenings and processes that meet our guidance. So whether it's different than other states, I can't say because I haven't reviewed all of the other universities' protocols, but I can tell you the ones here have been very careful and thoughtful and really superb. So let's hope that we have very limited spread in our community from our students.
This next question is from the Pittsburgh Business Times. Can you give us any thought about the convalescent plasma, given the word that the FDA is waiting on the emergency use authorization on it until there's more study? How important has it been in the treatment of people with COVID here in Allegheny County?
That is a great question. I will have to get back to you. I haven't looked at those data or spoken to anyone about the convalescent plasma studies at this point, not recently.
This next question is from WTAE. How did you react today when you saw the case count of 27 new reported cases?
Well, of course I was thrilled. On the other hand, I never take too much of one day's numbers. And so we've seen that before where we'll get a big drop in case numbers and the next day we catch up with some data from another lab that hasn't reported. So excited, but also, again, one day's data is one day's data. You really need to look sort of at a week at a time.
Cases have dropped significantly in the last couple weeks, says WESA. Is it possible numbers will return to our previous lows in May or early June?
I often joke with my staff that I really wish I had a working crystal ball, but I don't. So I try not to be too predictive, except to say that I would love the cases to continue to drop. I, of course, have my concerns as we go more indoors over time. You know, the fall, today is the first sort of cool-ish day in a while, and people tend to head indoors as it gets cooler. So we'll just watch and wait.
I have a few other questions on testing. First from WESA, should local hospital systems loosen their standards so that more people can be tested right now?
You know, for a while I was hearing that people were looking and not having access to tests, but I feel at this point we're not really hearing that. And again, that I think is reflected in our, that our case numbers are down so much that there's much less demand. The hospitals are following the protocols set out by the CDC for testing, and they're reserving their testing for symptomatic and for those who are close contacts of cases. So we look at, you know, if we thought it was necessary to expand, there are other places to get testing aside from the hospital system. So I think at this point we're in pretty good position here in terms of testing. Sorry.
This next question is from WTAE. Today's positive cases were out of a batch of fewer than 900 tests. Is there a benchmark number of tests that you'd like to see each day?
Yeah, I think I've been asked that question in the past, and my answer remains the same, which is testing should be responsive to the number of cases we have. So if we're seeing a rise in cases, I want to see a reflexive response in our count, our testing number. So I don't have a set number, but so I just watch to see that people are getting tests if they need them or want them, that there's availability, and that it's responsive to the case numbers.
And these final two questions from WTAE. How many restaurants are complying with the mitigation rules for reopening?
COVID field response team continues to see about 300, visit about 300 facilities a week, and our numbers are staying about the same. About 87 or 88% are fully in adherence to the recommendations. The number one issue tends to be proper mask wearing. Again, that hasn't changed.
And this last question again from WTAE. When can residents of Allegheny County expect to see flu shots available? Will the county health department be offering them again?
Yes, so thank you for that question about flu. I'm always happy to talk about influenza. We are hoping that flu vaccine will be available soon. I don't have an exact date yet, We will, of course, be offering influenza vaccine at our county health department, and I know that all of the healthcare facilities across the county are working on getting their flu vaccine and getting it available. There'll be many, many places to get flu vaccine this year: your primary care doctor, pharmacies, clinics, pop-up centers, FQHCs. Again, we'll all have flu vaccine, and we encourage everyone in our county, please get your flu vaccine this year. It's incredibly important for your own health and for the health of our community.
And that was the last question. If there are any closing comments.
Well, let me again thank Dr. Bogan and her team at the health department, who are working every day, round the clock, to keep people safe. She talked about the 5-minute break. I think it is about all they've gotten, because they're working case investigation, testing strategies, et cetera, to keep us safe. And you know, when we saw very low numbers in June, I think a lot of us were feeling pretty good. Mid-June, we were seeing numbers, cases in the teens and the 20s. And then obviously by late June, things, you know, started to go very high, 200, 300 cases a day. And the team came up with a strategy to be strategic, to not shut down all the economy, to not shut down all the activities, but to really highlight areas of strategically placing restrictions on where the cases and the evidence was taking us. They've done that, and we've seen, number one, a great level of cooperation in this community that has happened really since the very beginning, including now our restaurant association. As you mentioned, 80% when they go in and do some investigating, that they're complying with everything, wearing the masks, all the kind of things that we need to do. And the other thing, you know, I would encourage all of us to do, you know, our restaurants have taken, you know, a lot of issues with this, a lot brunt of the economic hurt. So, you know, please go out and patronize your restaurant. Do it differently. Do takeout, outdoor dining, you know, safe dining, those type of things. But we still want to continue to support these great local restaurants that are part of our community, part of our neighborhood, part of the things that we're doing. Do it safely. We're trying to do all kind of activities differently. We all know that that's different, how we visit with our families, how we go to work, other activities that we do, sports, different things, and restaurants also part of that. Again, I want to remind people we're getting near the end on the census. That's another activity you can do online and by phone, so that you don't have to interact, because someone will be coming to your door if you haven't responded to the census. And then the election. We want everybody to participate in the democratic process. We have obviously a big election coming up. Apply online, AlleghenyVotes.com. You can already apply for your mail-in ballot. It's going to be safe. It's going to be fine. Everything's going to go through properly. So that's again other activities that we're doing them differently, and we want to make sure. You know, we've seen some good news over the last couple of weeks, and sometimes when we see good news, a lot of us relax. It's a natural tendency, and then that roller coaster begins again, where the cases start to go up as people don't wear their masks as much as they should, don't social distance as much as they should, and then we see the bad numbers, and then we all get concerned again, start to act in a different way, in a more responsible way. So that roller coaster that we've been on literally since mid-March, I'm assuming is going to continue. So as Dr. Bogan said, we want everybody to continue to cooperate, wear your mask, social distance. All these college folks, kids who are come back to campus, off campus and on campus, we really need you to be participating. We need you to be responsible, to continue to do the good things that you do. You're going to great universities. We are so proud of the great universities we had. And as Dr. Bogan said, it's so much of our vibrancy in this community is the university students. What you bring to here is a jolt of energy and great vibrancy for this community, and we want that to continue. And it can only continue with cooperation. So let's continue to do the things we know we've learned over the last 5 or 6 months. Let's continue to cooperate. Let's continue to stay safe. Listen to Dr. Bogan and her team, and stay healthy this week. Stay healthy. Thank you.